Hi, I'm Dr. Mark Faber, child and adult psychiatrist in Upper Montclair, New Jersey, and I'm going to be speaking about behavioral strategies to address certain general areas, some of which we've touched on before. So sleep is one example, and many people before falling asleep, they tend to worry a lot, and then it becomes difficult to fall asleep. In this instance, I would say scheduling early evening worry time, 10 or 15 minutes, is generally helpful, where a person can go through their worries of the day and maybe just get them out either in conversation with another person or writing them down. And then when lying in bed and starting to think about and worry about the day's events, you can say to yourself, tomorrow is my worry time. It's at 7 p.m. and I've got 10 to 15 minutes to do it, so I'm not going to engage in this now. Also, it's very important to make use of relaxation exercises while in bed, and this could be diaphragmatic breathing, breathing in through the nose, holding it out through the mouth slowly, as if you're blowing out a candle. A second area in sleep where we think of behavioral strategies, this is a situation when kids tend to want to leave the bed and visit a parent. And that's when using the visit parent passes, 2 of those for 5 minutes. We're on the pass. It says visit parent for 5 minutes. Just having those passes is reassuring. And if the child needs to use them, they can. And if they use them appropriately and return to bed within 5 minutes, no more than twice in a night, then they are rewarded the next day. So that's another example with sleep. A third example has to do with night terrors. These take place typically within an hour to an hour and a half of falling asleep. The child wakes up suddenly, seems very confused, very upset, and they're not really awake. This occurs during what we call non-REM or non-rapid eye movement deep sleep. And in this instance, we don't encourage actually waking the person up, but rather tracking these wake-ups through night terrors over the course of a few weeks. And once it's clear around the time that they occur, for the next week to week and a half, the child can be awakened about 10 or so minutes prior to the anticipated night terror, and this may break the cycle. Another area in terms of behavior-based strategies that I wanted to touch on has to do with anger or irritability. And in this instance, it's very helpful to recognize the triggers of anger, the warning signs, and make use of relaxation techniques. And in this way, before an outburst occurs, ideally the child or adolescent can recognize this is something that does make me upset and triggers anger, and these are the warning signs. My body is tight, my voice is louder, and I need to kick in my breathing or relaxation exercises. Again, breathing in through the nose slowly, blowing out slowly through the mouth, in order to stay calm before the major outburst occurs. A third area, behaviorally, which I wanted to cover, is one we also addressed briefly before, and this is called habit reversal training for tics. So if a person has a repetitive behavior that they feel they must do, then we want them to develop a competing behavior. So if the behavior might be, exaggerated eye blinking or facial movements or a related behavior like hair pulling, we want a competing behavior. One example is pressing the thumb on the thigh and using some breathing techniques. Another approach for some people may be a rubber band, just on the wrist to move a little bit, flick a little bit, to draw the attention away from the other behavior. We want a competing behavior. Finally, I just wanted to add a behavioral strategy for separation anxiety, which is different than cognitive behavioral strategy, which we discussed earlier for anxiety. And in this situation, these are kids who they may ultimately go to school, but they're very distressed. They're in the nurse's office complaining of physical symptoms. And in this case, having pre-planned phone contact with a parent, just for maybe 2 or 3 minutes twice a day when this is really at its worst, and then tapering to once a day, then every other day, and then ultimately discontinuing and fading that out. So these represent an overview of behavior-based strategies for sleep, for anger, for habits, for separation issues as well. Thank you very much.